Hello and welcome to Docplexus News. Recently, Dr. Srinath Eknath Shinde has tabled Prevention of Violence Against Doctors, Medical Professionals and Medical Institutions Bill 2018 in Lok Sabha. This bill demands strict action against those who create violence in hospitals against doctors. According to the provisions of the bill, any offence committed under this act shall be cognizable, non-bailable and triable by the Court of Judicial Magistrate of the first class. Recently, the Delhi High Court rejected petitions filed by 8 pharma companies challenging Centre's ban on few FDCs used to treat type 2 diabetes. While recommending prohibition of manufacture and sale of these FDCs, the committee said there was no therapeutic justification and it may involve risk to human beings, so the plea was dismissed. The US FDA has recently approved a new bioelectronic device that will help the users get relief from sinus pain occurring due to allergic rhinitis. This handheld advanced neuromodulation device measures the user's skin properties and applies gentle microcurrent to stimulate the underlying nerves, thereby alleviating the sinus pain. The US FDA has given clearance to a new medical device invented by a Twin Cities neurosurgeon to detect signs of concussion by tracking a patient's eye movements. The device, called the Eyebox, was invented by Minnesota neurosurgeon Dr. Uzma Samadani. This device has been cleared as a quick, non-invasive test to detect concussions by having the patient watch a screen and track the eye movements. The US FDA has recently given the safety approval to an ongoing year-long stem cell treatment project for rotator cuff injuries led by researchers from North and South Dakota, USA. Rotator cuff tear injury is the most common cause of orthopedic impairments in the US. Therefore, FDA's safety approval of stem cell treatment will help to change the lives of millions of people suffering from it. The Health Ministry is actively considering compulsory licensing of rare disease drugs apart from price cap. However, recently the Department of Pharmaceuticals has issued an order exempting orphan drugs from price control. This decision has revealed a deep discordance between various arms of the government and has reduced accessibility to highly priced drugs. In order to make NHS a digital-first operation, smartphone consultation will now be replacing hospital and GP appointments. Within a decade, this new strategy of digital consultations would become a default option for patients and relieve pressure on hospitals. The head of NHS said that this shift would be continent for patients and they would be in touch with experts through their smartphones. In 2012, a young Pune gynecologist, Dr. Ganesh Rak, announced the plan for free delivery of all infant girls. He was promptly labelled as Mad Doc by the community. But today, the situation has changed. Thousands of small private clinics, some corporate hospitals, and over 2 lakh medicos in the country have joined this campaign. In the past 7 years, hospital has carried out 1,476 plus free deliveries of female child, whether normal, cesarean or even complicated cases, besides other treatment, medication and follow-ups. Let's hear about this unique campaign from Dr. Ganesh himself.
नमस्कार, मैं डॉक्टर गणेश राग, बेटी बचाओ जन आंदोलन। दोस्तों, पिछले 8 सालों से हम बेटी बचाओ जन आंदोलन में काम कर रहे हैं। हम हमारे मेडिकल हॉस्पिटल में लड़की होने के बाद कोई डिलीवरी की फीस नहीं लेते, डिलीवरी का कोई बिल नहीं लेते, लड़की का जन्म का जश्न मनाते हैं, मिठाई सबको देते हैं, केक कटवाते हैं। दोस्तों, सिर्फ हम अकेले नहीं काम करते हैं आंदोलन में। आज देश विदेश के लगभग 2 लाख के ऊपर डॉक्टर काम करने लगे हैं। लगभग 16 लाख के ऊपर वॉलंटियर्स जुड़े हैं। हमारे आपके ये दशक के महानायक बिग बी अमिताभ जी जुड़े हैं। हम आपको एक रिक्वेस्ट करते हैं कि आप भी ये बेटी बचाओ जन आंदोलन में जुड़ जाओ। आप भी अपने अपने जगह, अपने अपने फील्ड में जो भी कुछ लड़की के लिए कर सकते हो वो करो, और हम सब मिलकर ये लड़ाई साथ लड़ेंगे। हमें भरोसा है कि आने वाले कुछ सालों में इस देश में हर घर में लड़कियों होने के बाद लोग खुश हो जाएंगे। धन्यवाद।
Docplexus salutes Dr. Ganesh's initiative and urges our community to join hands for this unique campaign. These were the latest happenings in the medical field, brought to you by Docplexus, one of the largest online communities of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!